迎大家。
Welcome to today's press briefing. We have on the stage two doctors with us, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Zhang will give you an update on the cases. We recorded 698 PCR positive cases last night and also 709 RAT positive cases. Among the 709 RAT cases, 638 cases were reported to us via the online platform. So altogether, we have recorded 1,407 positive cases. In the past 3 days, between the 8th and the 10th of April, altogether, for the number of cases reported via the online platform, there are 2,875 cases. And the cumulative positive cases recorded since the start of the fifth wave is 1.17 million, including 739,000 PCR positive cases and 439,770 RAT cases. Of the 698 PCR positive cases, 126 cases were reported by the HA, 126 cases reported by the Public Health Laboratory Health Services of the CHP, and 446 cases reported by private laboratories. We conducted whole genome sequencing for 582 cases, and so far we have not found any case carrying L452R, whereas for 577 other cases, they are L452R negative, meaning they're all Omicron cases. There are 5 remaining cases with insufficient viral load or at the pending status. We also recorded 13 imported cases today, 5 concerning arrivals from yesterday, 3 from UK 384, and 1 TR 980, and also the other TG 600. These were individuals arrived in Hong Kong earlier. As for residential care homes, we have not recorded new outbreaks. For existing homes with outbreaks, there are 35 positive cases regarding residents and 5 regarding staff members, and these cases are from 22 RCHEs and 6 RCHDs. The Hospital Authority reported 57 new death cases, and cumulatively, the HA already reported 8,555 death cases. Together with other death cases, the total death toll stands at 8,614. For the 8,614 death cases, they are respectively 3,517 females and 5,097 males. As for the age brackets, they age from 11 months and 112, with the median age being 86. There are 8 cases involving children below the age of 7. The analysis otherwise, by and large, remains the same. Dr. Lee will report on HA's situation. There are 9,327 patients receiving treatment at public hospitals, North Lantau Hospital, Hong Kong Infectious Control Center, HA Communicable Disease Center, and also treatment facility at AWE. 8 patients were in critical condition as reported last night. 5 of them did not have any vaccination record. 3 had 1 jab. 13 cases in serious condition, and so far 60 critical patients are now receiving treatment in ICU units. As of midnight tonight, over the past 24 hours, 52 COVID positive patients passed away. They were respectively 25 males and 27 females. As for the patients who passed away yesterday, 26 of them were from residential care homes. 33 patients did not have any vaccination record, and only 1 of them had 3 jabs. As for the 52 patients who passed away, 49 of them were elderly patients above the age of 65. I'd like to give a comparison. I'd like to give the case analysis of 2 younger patients. For the 52-year-old female, she did not have any vaccination record. She was chronically ill, and she also had lung cancer. And there was metastasis. In mid-March, according to her deep throat saliva specimen, she tested positive, and she was resting at home. And then starting from the 21st of March, she started to do RATs, and she continued to have RAT negative results. That's according to the patient's self-reporting. On the 26th of March, she visited the A&E unit of Eastern Hospital because of shortness of breath. X-ray examination revealed that she had pulmonary edema, and after she was admitted to hospital, treatment was provided, including steroid and antibiotics. Her condition then improved, and she decided to be discharged. But the following day, she was admitted to hospital again. She was admitted to the Queen Mary Hospital, and then her condition continued to deteriorate until the 10th of April at 2:52 a.m. she passed away. The second case was a 61-year-old female. She had 2 BioNTech jabs. The second dose was administered on the 30th of March. That means less than 2 weeks from when she passed away. Again, she was a lung cancer patient. She was undergoing chemotherapy. In early April, her RAT result became positive. On the 8th of April, she visited the designated COVID clinic for medical consultation. She had a shortness of breath and fever, and she was somewhat in a daze, and her blood oxygen level was on the low side, so she was transferred to the A&E unit of Yanchai Hospital. X-ray examination revealed that she had pneumonia. She received remdesivir and also steroid. Upon being admitted to hospital, and in the afternoon of the 10th of April, she passed away. Because of data lagging, I'd like to report 5 patients who passed away on the 9th of April, close to midnight. They include 4 males and 1 female. And yesterday, more 360 patients were discharged upon recovery. 5 patients were found to be positive upon hospital admission screening, and some patients have been listed as close contacts. They share the same ward. And so far, 22,000 plus HA staff have been infected, and 20,340 of them have resumed their duties. The floor is now open. Please raise your hand and use the mic and introduce the media organization you represent. I'm from Now TV. For PCR and RAT case numbers, I understand that the figures have respectively dropped to a 3-digit figure. And we just concluded the 3-day RAT exercise. What is the CHP's assessment on the effectiveness of the territory-wide RAT testing? And what is your analysis on this declining trend? And are there asymptomatic patients? Can you tell the trend? For example, where in Hong Kong we tend to find more cases? And also, how many of the positive cases had home isolation treatment or went to community isolation facility? And about the introduction of oral medication, can you tell us about your negotiation process and who will be the target users? On the whole, in the past 2 weeks, we see a continuous decline in the number of confirmed cases in Hong Kong, and the rate of decline has remained stable. And on the whole, the percentage of RAT positive and PCR positive cases by and large remain half and half. And yet a few days ago, we began to find that the RAT positive cases have increased while PCR figures have dropped. And we understand that it has to do with a territory-wide RAT exercise and that more cases have been identified. As for the 3-day figure, we understand that there's been a drop. Perhaps during the first day, positive cases have already been identified. And in the second, third days, again, the positive cases have already been identified in the first day.
In the previously discovered positive cases, as mentioned by our colleagues, about 65% actually of the reported cases had symptoms, and the remaining 35% were asymptomatic. And in the 2,800 cases discovered in the 3 days, is the reverse. 35% had symptoms, about 65% had no symptoms. That is, in the community, there were asymptomatic people because of the mass RAT, and they were identified, and they were known to be positive and could be isolated. In terms of isolation measures, well, there's no difference from before. We'll look at whether any high-risk factors associated with the cases, any environmental high-risk factors, and then we'll determine whether the person concerned should be allowed to isolate at home. I think about 80% of the people were found to be suitable for at-home isolation. As for AstraZeneca drug, the HA will continue to monitor the use of the drug, and EUCell, this drug, is a monoclonal antibody. It is an injection drug. In overseas, so far, they would apply it in patients with weak immunity and patients who are not actually suitable for vaccination. Therefore, its application would be determined on the basis of the development of the pandemic and clinical evidence. And we also consult experts first before applying it. But let me remind the public, still preventing COVID, in terms of prevention, vaccination is the most effective means. Preventive medicine cannot replace vaccination. Next one. Gentleman in white at the back. From TVB. The government announced that they're going to relax the social distancing measures in phases. In the past 2 weeks, pandemic has eased a bit, and as Dr. Chong said, the figures have come down, but still they are in 4 digits, even though they have leveled a bit. So how would you assess the relaxation of the social distancing measures in a week's time? Are you worried that after the relaxation, the case numbers might rebound? And also, on the overall trend of the pandemic, we can see that in this month, the confirmed cases, do you think it could possibly come down to 3 digits? Whether through the RAT test or, sample testing, there may be 100 cases found, but is there any chance for the overall case numbers to come down at all? And also in schools, well, there have been updates on resumption of classes. The Department of Health, can you tell us when would you intervene when there's a certain number of cases? Have you drawn any line? And also, can you tell me of the imported cases today, how many were discovered by RAT and how many were found by specimen collection? I think 4 cases were found by RAT. The other were discovered through PCR tests in relation to the imported cases you asked. And the downward trend is quite stable now, and we haven't seen any rebound yet. I know that the social distancing measures will be relaxed in stages. I think the most important is that we all actually observe personal hygiene and wear masks properly and don't have too much close contacts with other people. For schools, this morning, the director mentioned already that we will intervene should of the overall school students and teachers, if 5% were positive, then there'll be intervention. We will not come down with a specific figure because school sizes vary. So the actual measures with large and small schools could vary. And also for individual classrooms or gatherings or class, if a certain percentage, that is more than 10% of the students were confirmed, that would trigger the intervention. Or if there were students in the school who were found to be a serious case or even death, then we'll see what we should do. This one at the back. Cable TV. You can see in the 3 days RAT testing that's ended in the past 3 days, whether it's positive or negative. What about the total number of cases reported? And do you think the total number of cases reported, are they within your expectation? And you mentioned AstraZeneca's drug, HA. Are you planning to import the drug, and what is the budget you reserved for importing the drug? For the cases reported on the 10th, we can get the figures. You can actually find a number on our website tonight, because there's still some procedures to be processed before we can actually make known the total figure. And the final figure should be available tomorrow for the past 3 days. At this moment, up to yesterday, we've got 3,875 positive cases. We wouldn't know how many negative cases there were because people who tested negative need not report to us. We expect that since there's this RAT exercise and more people would be found positive, and as that's reflected in the figures on April 8th. On April 9th, we found that, the downward trend the day before rebounded a bit as a result of the RAT positive cases, because several hundred cases were discovered, which if there were no RAT available, then they might not have been discovered. As for AstraZeneca COVID-19 antibody drug, we need to study the supply and the usage of the drug and the latest figures first. Since the drug is to be injected, so we would recommend that it will be administered to people who are not suitable for vaccination and whose immunity is weak. We also need to study the local situation and the latest clinical figure worldwide before we can make a decision. The next one, a lady at the back. I'm from Mingpao. I want to ask about the 3-day voluntary RAT, which came to an end. The numbers discovered, positive cases discovered, well, so far have been on a downward trend. How would you describe the latest exercise? Do you think the public have actually responded overwhelmingly? And also the proportion of patients with symptoms also changed. Does that mean that the RAT previously might have missed many asymptomatic cases? Would you consider that maybe distribute RAT to the public so that they can perform RAT more often so as to identify or keep identifying asymptomatic cases? And also today, the 52-year-old death case, on March 21st, she tested negative from RAT, and then she had shortness of breath, and she found that she had pulmonary edema. So shortness of breath and the pulmonary edema, were they related to COVID? Is it possible that she had not recovered, or because of other factors that she had developed the problems, and she was allowed to be discharged? And since she had lung cancer, do you think that there had been some sort of medical misjudgment that she shouldn't have been allowed to be discharged? Would you classify this case as die with or die of COVID? and also for private doctors to prescribe oral drugs. Any other details available? When that can be available?
I think, as explained, we believe that the RAT exercise has been successful in identifying positive cases which are asymptomatic. Previously, these individuals might not have undergone the test, and now with RAT, these cases are identified. I understand that RAT kits are distributed at the service points, and we welcome more reporting by members of the public once they've completed RAT tests. The Omicron carriers may sometimes be asymptomatic, and if one of your friends or your family has been infected, you might be concerned and you might want to do the test. Now, after these 3 days, if you want to do another RAT test, of course you're welcome. About oral medication, the 25th of February, we implemented the arrangement for the first time to lend drugs to private hospitals. And we have provided 400 courses of COVID oral medication to 13 private hospitals. We further streamlined the procedure, and if need be, they can apply for more prescriptions from us. I understand for private doctors, the government is still discussing with the profession to iron out details. We do believe that this arrangement will be conducive to facilitating patients' treatment and will provide full support. For the 52-year-old female patient, as I explained, she was a lung cancer patient with metastasis to different organs. In March, as I explained, she tested negative, and then for subsequent RAT tests, she tested negative. We believe the major reason for hospital admission was pulmonary edema. On the 26th of March, when she went to the A&E unit, the CT value was 39, as she conducted another round of RAT. So we believe that in terms of COVID, this patient was on a path of recovery, and she was admitted to hospital, and then she expressed her wish. She wished to be discharged, and that is why our doctors allowed her to be discharged. She was later admitted to Queen Mary Hospital, and her condition continued to deteriorate until she passed away on the 10th of April. Next question, this lady. I'm from Hong Kong 01. I have 3 questions. First, a question for HA about the number of or the detail of patients who passed away after receiving 3 jabs. I understand that elderly patients are now administered with Sinovac, and these patients reside in residential care homes, whereas BioNTech offers stronger protection. Will you consider jabbing residential care home residents with BioNTech? Do you have figures about the number of elderly people receiving the 4th jab, and are there cases reported to you about serious side effects? I understand that some care homes have arranged for BioNTech to be administered, but I don't have details. I don't have details about bookings for the 4th jab either. For the deceased who received 3 jabs before passing away, she was a 74-year-old female patient receiving treatment at Queen Mary Hospital. She passed away in April in the morning, but I don't have details about her clinical status. This gentleman over here. I'm Feng Puyin from ... News. We've completed the 3-day mass RAT exercise, and my question is this. As a next step, will there be further arrangements to control the epidemic? Another question. The government will relax social distancing measures further on the 21st of this month. So how do you strike a balance between controlling the epidemic and relaxing the social distancing measures? Of course, the government has to take into account different factors. Case figures and public health is one of the factors. I understand that if there is not a major rebound or surge in the number of confirmed cases, social distancing measures will be relaxed in phases. Next, are there other questions? This gentleman. I'm from AM 730. About the voluntary mass RAT, do you have details about the close contacts of the 2,700 positive cases who have become positive as well? And is it in line with the government's earlier assessment? Now, for the some 2,000 cases identified, how do you gauge the effectiveness in curbing transmission chains in the community? We managed to identify 2,800 plus cases. Each case could spark another transmission chain in the community. So, of course, it definitely helps in controlling the epidemic. As for close contacts of these cases, whether they will become positive as well, I don't have the details. But close contacts are usually family members. So once a person is infected, all the household members should be subject to quarantine. If there are no other questions, that's the end of today's press briefing. Thank you.